Question 1. A nurse is caring for a patient with a history of hypertension who is prescribed an ACE inhibitor. Which statement by the patient indicates a need for further teaching about the medication? A. I will report any persistent cough or difficulty breathing. B. I will monitor my blood pressure regularly. C. I will avoid foods high in potassium. D. I will take my medication with food.
You have 1 minute to answer your question.
Question 2. A nurse is caring for a patient who is scheduled for surgery in the morning. Which of the following actions should the nurse take in the evening before the surgery? A. Administer pain medication as ordered. B. Explain the surgical procedure to the patient. C. Offer the patient a high-protein meal. D. Ensure the patient has signed the informed consent form.
You have 1 minute to answer your question.
Question 3. A nurse is caring for a patient who is receiving a blood transfusion. Which of the following assessments should the nurse perform during the transfusion? A. Monitor for signs of an allergic reaction. B. Assess lung sounds every 4 hours. C. Obtain vital signs before the transfusion every 2 hours during the transfusion. D. Evaluate the patient's urine output every hour.
You have 1 minute to answer your question.
Question 4. A nurse is caring for a patient who has a prescription for furosemide, Lasix. Which of the following electrolyte imbalances should the nurse monitor for in this patient? A. Hyperkalemia. B. Hypocalcemia. C. Hypokalemia. D. Hypercalcemia.
You have 1 minute to answer your question.
Question 5. A nurse is caring for a patient who has a nasogastric NG tube in place for decompression. Which of the following interventions should the nurse perform to prevent complications related to the NG tube? A. Irrigate the NG tube with sterile saline every 4 hours. B. Check the placement of the NG tube before administering medications. C. Clamp the NG tube when the patient is ambulating. D. Place the patient in a supine position for at least 1 hour after administering feedings.
You have 1 minute to answer your question.
Question 6. A nurse is caring for a patient who is receiving chemotherapy. Which of the following interventions should the nurse implement to prevent infection? A. Administer anti-diarrheal medications as ordered. B. Provide oral care every 4 hours. C. Encourage the patient to ambulate frequently. D. Administer pain medication as needed.
You have 1 minute to answer your question.
Question 7. A nurse is caring for a patient with a history of alcohol abuse who is admitted to the hospital with acute pancreatitis. Which of the following interventions should the nurse include in the patient's care plan? A. Administer alcohol withdrawal medications as needed. B. Encourage the patient to eat a low-fat diet. C. Monitor the patient's blood glucose levels. D. Administer antacids as ordered.
You have 1 minute to answer your question.
Question 8. A nurse is caring for a patient who is receiving a continuous intravenous infusion of heparin. Which of the following interventions should the nurse implement to monitor the patient for potential complications? A. Monitor the patient's prothrombin time, PT, and international normalized ratio, INR. B. Monitor the patient's urine output. C. Monitor the patient's blood glucose levels. D. Assess the patient for signs of bleeding.
You have 1 minute to answer your question.
Question 9. A nurse is caring for a patient who is receiving mechanical ventilation. Which of the following interventions should the nurse implement to prevent ventilator-associated pneumonia, VAP? A. Elevate the head of the bed to at least 30 degrees. B. Provide oral care every 8 hours. C. Administer prophylactic antibiotics. D. Encourage the patient to cough forcefully.
You have 1 minute to answer your question.
Question 10. A nurse is caring for a patient who has a history of hypertension and is prescribed lisinopril. Which of the following interventions should the nurse implement to monitor the patient for potential complications? A. Monitor the patient's blood pressure. B. Monitor the patient's blood glucose levels. C. Monitor the patient's urine output. D. Monitor the patient's respiratory rate.
You have 1 minute to answer your question.
Question 11. A nurse is caring for a patient who has been diagnosed with bipolar disorder and is prescribed lithium. Which of the following interventions should the nurse implement to monitor the patient for potential complications? A. Monitor the patient's potassium levels. B. Encourage the patient to drink plenty of fluids. C. Monitor the patient's weight. D. Monitor the patient's lithium levels.
You have 1 minute to answer your question.
Question 12. A nurse is caring for a patient who is admitted to the hospital with a diagnosis of acute respiratory distress syndrome, ARDS. Which of the following interventions should the nurse implement to manage the patient's care? A. Administer oxygen therapy as needed. B. Administer prophylactic antibiotic oxygen therapy as needed. B. Administer prophylactic antibiotics. C. Administer antidiarrheal medications as ordered. D. Administer pain medication as needed.
You have 1 minute to answer your question.
Question 13. A nurse is caring for a patient who has a stage IV pressure ulcer. Which of the following interventions should the nurse implement to manage the patient's care? A. Turn the patient every 2 hours. B. Apply heat to the affected area. C. Massage the affected area to promote circulation. D. Apply a sterile dressing to the ulcer.
You have 1 minute to answer your question.
Question 14. A patient is admitted to the hospital with a urinary tract infection. Which nursing intervention should be implemented to prevent the spread of infection to other patients? A. Placing the patient in a private room. B. Allowing visitors without restriction. C. Sharing equipment between patients. D. Reusing personal protective equipment.
You have 1 minute to answer your question.
Question 15. A patient is receiving intravenous medication through a central line catheter. What is the most important intervention to prevent infection? A. Cleaning the skin with soap and water. B. Changing the dressing every 48 hours. C. Using a sterile technique when accessing the catheter. D. Administering medication slowly over 30 minutes.
You have 1 minute to answer your question.
Question 16. A patient with a suspected respiratory infection is admitted to the hospital. Which type of precaution should the nurse implement? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Standard precautions.
You have 1 minute to answer your question.
Question 17. A patient with an indwelling urinary catheter is at risk for which of the following infections? A. Respiratory infection. B. Gastrointestinal infection. C. Urinary tract infection, UTI. D. Skin infection.
You have 1 minute to answer your question.
Question 18. Which of the following should the nurse prioritize when providing care for a patient with Clostridium difficile, C. diff? A. Wearing gloves and gown when entering the patient's room. B. Encouraging the patient to ambulate frequently. C. Administering antibiotics to the patient. D. Allowing family members to visit freely.
You have 1 minute to answer your question.
Question 19. When caring for a patient with a central venous catheter, CVC, which of the following is the most important action for the nurse to take to prevent infection? A. Changing the dressing over the catheter daily. B. Administering antibiotics to the patient. C. Flushing the catheter with clean after each use. D. Removing the catheter as soon as possible.
You have 1 minute to answer your question.
Question 20. A patient is prescribed antibiotics to treat an infection. What is the primary reason a nurse should monitor for adverse drug reactions? A. To prevent the spread of infection to other patients. B. To ensure the patient completes the full course of antibiotics. C. To assess the effectiveness of antibiotic treatment. D. To identify any negative side effects or complications.
You have 1 minute to answer your question.
Question 21. The nurse is preparing to administer medication to a patient with a history of severe allergic reactions. Which of the following interventions should the nurse take to promote patient safety? A. Administer the medication quickly to minimize discomfort. B. Monitor the patient for adverse reactions after administration. C. Encourage the patient to take the medication with a full meal. D. Avoid informing the patient of potential side effects to prevent anxiety.
You have 1 minute to answer your question.
Question 22. A patient is admitted with a healthcare-associated infection, HAI. What should the nurse do to prevent the spread of infection? A. Administer prophylactic antibiotics. B. Avoid wearing gloves when providing care to the patient. C. Encourage visitors to wear masks when in the patient's room. D. Follow appropriate isolation precautions.
You have 1 minute to answer your question.
Question 23. A patient is prescribed a high dose of a medication that is known to be toxic to the liver. What should the nurse monitor for to prevent potential complications? A. Hypertension. B. Bradycardia. C. Jaundice. D. Edema.
You have 1 minute to answer your question.
Question 24. A nurse is providing oral care to an unconscious client. The client has a gag reflex. What is the nurse's best action? A. Avoid performing oral care. B. Use suction to remove secretions. C. Administer sedation to reduce the gag reflex. D. Turn the client on their side.
You have 1 minute to answer your question.
Question 25. A client who is post-operative is experiencing nausea and vomiting. Which of the following interventions by the nurse would be the most appropriate? A. Offer the client high-fat foods to promote satiety. B. Encourage the client to drink carbonated beverages. C. Administer anti-medication as ordered. D. Restrict fluid intake to prevent further vomiting.
You have 1 minute to answer your question.
Question 26. A client with a urinary catheter complains of discomfort and pressure. The nurse assesses the client's catheter and notes that there is no urine output. What is the nurse's best action? A. Irrigate the catheter with sterile saline solution. B. Clamp the catheter and wait for the physician's orders. C. Increase the client's fluid intake. D. Reassure the client that these symptoms are normal.
You have 1 minute to answer your question.
Question 27. A client with diabetes is admitted to the hospital. The nurse assesses the client's blood glucose level and finds it to be 50 mg/dL. What is the nurse's best action? A. Administer a dose of regular insulin. B. Encourage the client to eat a high-carbohydrate meal. C. Administer a dose of glucagon. D. Administer a dose of long-acting insulin.
You have 1 minute to answer your question.
Question 28. A client with chronic obstructive pulmonary disease, COPD, is experiencing dyspnea and difficulty breathing. Which of the following interventions by the nurse would be the most appropriate? A. Administer a bronchodilator as ordered. B. Place the client in a prone position to promote oxygenation. C. Administer a sedative to promote relaxation. D. Encourage the client to perform deep breathing exercises.
You have 1 minute to answer your question.
Question 29. A client with a history of alcohol abuse is admitted to the hospital with acute pancreatitis. Which of the following interventions by the nurse would be the most appropriate? A. Encourage the client to drink clear liquids. B. Administer pain medication as ordered. C. Place the client on a clear liquid diet. D. Administer an alcoholic beverage to prevent withdrawal.
You have 1 minute to answer your question.
Question 30. A client with a history of heart failure is admitted to the hospital. Which of the following interventions by the nurse would be the most appropriate to promote comfort and prevent complications? A. Place the client on a low-sodium diet. B. Administer a diuretic as ordered. C. Encourage the client to ambulate. D. Provide the client with oxygen therapy.
You have 1 minute to answer your question.
Question 31. A client is admitted to the hospital with a diagnosis of cirrhosis. The nurse notes that the client's abdomen is distended and the client is complaining of abdominal discomfort. What should the nurse do first? A. Administer pain medication. B. Assess the client's vital signs. C. Check the client's lab results. D. Assist the client with ambulation.
You have 1 minute to answer your question.
Question 32. Which of the following medications is commonly used as an anticoagulant? A. Amoxicillin. B. Aspirin. C. Insulin. D. Ibuprofen.
You have 1 minute to answer your question.
Question 33. Which of the following routes of drug administration bypasses the gastrointestinal tract? A. Intravenous, IV injection. B. Subcutaneous injection. C. Oral administration. D. Intramuscular, IM injection.
You have 1 minute to answer your question.
Question 34. Which medication is commonly used to treat hypertension? A. Metformin. B. Lisinopril. C. Warfarin. D. Acetaminophen.
You have 1 minute to answer your question.
Question 35. What is the primary purpose of administering opioids? A. To induce anesthesia. B. To treat bacterial infection. C. To reduce inflammation. D. To relieve pain.
You have 1 minute to answer your question.
Question 37. What is the primary purpose of administering heparin? A. To lower cholesterol levels. B. To prevent blood clot formation. C. To treat bacterial infections. D. To relieve pain.
You have 1 minute to answer your question.
Question 38. Which of the following medications is commonly used as an antipsychotic? A. Atorvastatin. B. Sertraline. C. Olanzapine. D. Metformin.
You have 1 minute to answer your question.
Question 39. Which medication is commonly used as a first-line treatment for type 2 diabetes? A. Insulin glargine. B. Metformin. C. Lisinopril. D. Warfarin.
You have 1 minute to answer your question.
Question 39. Which medication is commonly administered to counteract severe allergic reactions? A. Prednisone. B. Diphenhydramine. C. Acetaminophen. D. Albuterol.
You have 1 minute to answer your question.
Question 40. Which medication is commonly administered to counteract severe allergic reactions? A. Prednisone. B. Diphenhydramine. C. Acetaminophen. D. Albuterol.
You have 1 minute to answer your question.
Question 41. What is the primary purpose of administering a diuretic medication? A. To lower blood pressure. B. To treat bacterial infections. C. To relieve pain. D. To control blood glucose levels.
You have 1 minute to answer your question.
Question 42. A patient admitted to the emergency department with shortness of breath, wheezing, and a history of asthma is experiencing which potential risk? A. Infection. B. Hypotension. C. Respiratory distress. D. Urinary retention.
You have 1 minute to answer your question.
Question 43. A patient who underwent surgery is prescribed a blood thinner medication. Which potential risk should the nurse monitor for in this patient? A. Hypertension. B. Deep vein thrombosis. C. Hyperglycemia. D. Constipation.
You have 1 minute to answer your question.
Question 44. A patient with diabetes is prescribed insulin therapy. The nurse should educate the patient about which potential risk? A. Hypoglycemia. B. Hyperkalemia. C. Hypothyroidism. D. Hypertension.
You have 1 minute to answer your question.
Question 45. A postoperative patient is at risk for impaired wound healing due to which potential risk factor? A. Malnutrition. B. Hypothermia. C. Hypertension. D. Hypernatremia.
You have 1 minute to answer your question.
Question 46. A patient with a history of falls is at risk for which potential complication? A. Pneumonia. B. Urinary tract infection. C. Fractures. D. Hypertension.
You have 1 minute to answer your question.
Question 47. A patient receiving long-term corticosteroid therapy is at risk for which potential complication? A. Hypoglycemia. B. Hypokalemia. C. Osteoporosis. D. Hypertension.
You have 1 minute to answer your question.
Question 48. A patient with a history of seizures is at risk for which potential complication? A. Hypothyroidism. B. Respiratory distress. C. Status epilepticus. D. Hypernatremia.
You have 1 minute to answer your question.
Question 49. A patient with a history of deep vein thrombosis, DVT, is at risk for which potential complication? A. Pulmonary embolism. B. Hyperkalemia. C. Osteoporosis. D. Urinary retention.
You have 1 minute to answer your question.
Question 50. A patient has been diagnosed with hypothyroidism. Which of the following signs or symptoms would be consistent with this condition? A. Weight gain and fatigue. B. Weight loss and hyperactivity. C. Increased thirst and urination. D. Rapid heartbeat and palpitations.
You have 1 minute to answer your question.
Question 51. A nurse is assessing a patient with chronic obstructive pulmonary disease, COPD. Which of the following findings is an adaptive response to the patient's condition? A. Decreased respiratory rate. B. Increased oxygen saturation. C. Barrel chest appearance. D. Increased lung capacity.
You have 1 minute to answer your question.
Question 52. A nurse is caring for a patient with heart failure. Which of the following compensatory mechanisms would the nurse expect to find in this patient? A. Decreased heart rate. B. Decreased blood pressure. C. Peripheral vasoconstriction. D. Decreased urine output.
You have 1 minute to answer your question.
Question 53. A patient with diabetes insipidus presents with excessive thirst and diluted urine. What physiological adaptation is impaired in this patient? A. Glucose regulation. B. Sodium regulation. C. Water balance regulation. D. Blood pressure regulation.
You have 1 minute to answer your question.
Question 54. A nurse is caring for a patient with cirrhosis of the liver. Which of the following laboratory findings would be expected due to impaired liver function? A. Elevated bilirubin levels. B. Decreased ammonia levels. C. Increased albumin levels. D. Decreased clotting factors.
You have 1 minute to answer your question.
Question 55. A nurse is caring for a patient with chronic kidney disease, CKD. Which of the following electrolyte imbalances would the nurse anticipate in this patient? A. Hyponatremia. B. Hyperkalemia. C. Hypocalcemia. D. Hypophosphatemia.
You have 1 minute to answer your question.
Question 56. A patient with a spinal cord injury at the level of C5 is experiencing diaphragmatic breathing. What is the primary reason for this physiological adaptation? A. Paralysis of intercostal muscles. B. Disruption of the phrenic nerve. C. Loss of sensation in the diaphragm. D. Decreased lung compliance.
You have 1 minute to answer your question.
Question 57. A patient with chronic anemia has developed tachycardia. What is the physiological adaptation that explains this finding? A. Increased red blood cell production. B. Decreased oxygen carrying capacity. C. Decreased cardiac output. D. Impaired cardiac conduction.
You have 1 minute to answer your question.
Question 58. A patient is experiencing a prolonged period of fasting. Which of the following adaptations would the nurse expect to occur? A. Increased insulin production. B. Increased glycogenolysis. C. Increased gluconeogenesis. D. Increased lipid synthesis.
You have 1 minute to answer your question.
Question 59. A nurse is caring for a patient with Addison's disease. Which of the following electrolyte imbalances is commonly associated with this condition? A. Hypernatremia. B. Hypokalemia. C. Hypocalcemia. D. Hypermagnesemia.
You have 1 minute to answer your question.
Question 60. Which immunization should be given to infants at birth to provide protection against hepatitis B? A. MMR vaccine. B. Diphtheria, tetanus, and pertussis vaccine. C. Inactivated polio vaccine, IPV. D. Hepatitis B vaccine.
You have 1 minute to answer your question.
Question 61. Which dietary modification is recommended for a patient with hypertension? A. Decrease sodium intake. B. Increase saturated fat intake. C. Increase caffeine consumption. D. Increase alcohol consumption.
You have 1 minute to answer your question.
Question 62. What is the primary goal of health promotion during prenatal care? A. Preventing complications during labor. B. Promoting healthy fetal development. C. Monitoring maternal blood pressure. D. Preventing premature birth.
You have 1 minute to answer your question.
Question 63. Which activity is an example of primary prevention in the context of preventing cardiovascular disease? A. Performing regular cholesterol screenings. B. Prescribing medication to control blood pressure. C. Providing smoking cessation counseling. D. Promoting a healthy diet and regular exercise.
You have 1 minute to answer your question.
Question 64. What is the recommended frequency for breast self-examination, BSE, in women? A. Monthly. B. Every 3 months. C. Every 6 months. D. Annually.
You have 1 minute to answer your question.
Question 65. Which statement is true regarding immunization? A. Immunization provides immediate protection against diseases. B. Immunization is only necessary during childhood. C. Immunization can help eradicate certain diseases. D. Immunization is not effective against viral infections.
You have 1 minute to answer your question.
Question 66. What is the purpose of a pap smear test? A. Detecting ovarian cancer. B. Detecting cervical cancer. C. Detecting breast cancer. D. Detecting uterine cancer.
You have 1 minute to answer your question.
Question 67. Which lifestyle modification is recommended to reduce the risk of osteoporosis? A. Increasing calcium and vitamin D intake. B. Smoking cessation. C. Limiting sun exposure. D. Decreasing physical activity.
You have 1 minute to answer your question.
Question 68. Which statement best describes the concept of empathy in nursing care? A. Empathy is the ability to understand and share the feelings of another person. B. Empathy refers to the process of diagnosing mental health disorders. C. Empathy is an intervention used to modify negative behavior. D. Empathy is the physical care provided to patients.
You have 1 minute to answer your question.
Question 69. Which nursing intervention is appropriate for promoting dignity in a patient? A. Providing privacy during personal care activities. B. Administering medication without patient consent. C. Minimizing opportunities for patient self-expression. D. Ignoring patient preferences and cultural beliefs.
You have 1 minute to answer your question.
Question 70. Which behavior is an example of active listening by the nurse? A. Interrupting the patient to offer advice. B. Checking social media while the patient speaks. C. Making eye contact and nodding in affirmation. D. Ignoring the patient's concerns and emotions.
You have 1 minute to answer your question.
Question 71. Which statement best describes cultural competence in nursing practice? A. Cultural competence involves prioritizing one's own cultural beliefs and practices. B. Cultural competence requires nurses to ignore cultural differences among patients. C. Cultural competence refers to the ability to understand and respect diverse cultural backgrounds. D. Cultural competence focuses exclusively on physical health aspects of care.
You have 1 minute to answer your question.
Question 72. Which nursing intervention demonstrates advocacy for a patient's rights? A. Coercing the patient into accepting a specific treatment. B. Disregarding the patient's preferences and decisions. C. Encouraging the patient to voice concerns and ask questions. D. Withholding information about the patient's condition.
You have 1 minute to answer your question.
Question 73. Which therapeutic communication technique can help a nurse establish trust with a patient experiencing anxiety? A. Minimizing eye contact to reduce the patient's discomfort. B. Providing false reassurance to alleviate the patient's anxiety. C. Reflecting the patient's feelings to demonstrate understanding. D. Ignoring the patient's anxious behaviors and concerns.
You have 1 minute to answer your question.
Question 74. Which approach by the nurse is appropriate when providing care to a patient with a history of trauma? A. Dismissing the patient's traumatic experiences as irrelevant. B. Encouraging the patient to constantly recount the traumatic event. C. Establishing a safe and non-threatening environment for the patient. D. Avoiding any discussion related to the patient's trauma.
You have 1 minute to answer your question.
Question 75. Which action by the nurse demonstrates the ethical principle of autonomy? A. Making decisions for the patient without their involvement. B. Respecting the patient's right to make decisions about their care. C. Withholding information from the patient to protect them. D. Coercing the patient into following the healthcare provider's orders.
You have 1 minute to answer your question.